In this video, we will discuss about this Velcro-like binding when it's combined with this tumor-associated carbohydrate antigen can improve cancer therapy efficacies. So basically the problem current cancer therapies face is the on-target of cancer toxicities. So what is this on-target of cancer toxicities? It means that suppose antibodies that are used in cancer therapy are very specific to a antigen, and those antigens are overexpressed on the cancer cells, but they are also expressed on the healthy cells at a lower rate. So sometimes this antigen, these antibodies that is used in the cancer therapy can also target the healthy tissues, resulting in toxicities. So these things can be avoided by using this Velcro-like binding. So this Velcro-like binding will ensure that their antibodies will only act when their antigens are expressed or overexpressed, and these things are more specific to the tumors than the healthy cells. And in order to use this Velcro-like binding, the best candidates to target on the tumor cells are these tumor-associated carbohydrate antigens, because they are overexpressed on the cancer cells, but they are expressed in lower amount in the healthy cells. And we will understand by going through the abstract in this video, so that we will understand their concepts in detail and we will face less problem in understanding their results. So they designed this GlyTR, that is Glycan dependent T cell recruiter. So what it does is it has this property of this Velcro like binding, that is it will act on those cells that is present and that has this antigen expressions in high amount, or that has the overexpression of the antigens. So this is just an analogy that is shown here. It is glycocalyx like surface is there, and this Glycan dependent T cell recruiter, it has an antigen, it has affinity towards this glycocalyx like surface, so it will easily bind to this glycocalyx which is overexpressed on the cancer cells. And this is just an analogy for the actual glycocalyx, which has this N-glycan beta-1,6 branching on the top, and then this O-glycan which has this TN and STN which are overexpressed on the cancer cells, and there are other glycan structures also, GD2, GM2 like DNAC. So how this GlyTR works is that this GlyTR has these two antibodies that we have discussed when we understand how this bite works. So on one side it has this anti-CD3 which can target the T cells, and on other side it has this TACA based monoclonal antibodies. So this TACA is tumor-associated carbohydrate antigens, and it will act when these tumor-associated carbohydrate antigens are overexpressed on the cells, which is the case in the cancer cells, but not in the case for normal cells. So it will not act on normal cells, but it will act on the cancer cells, and the other side of the antibodies will act on the T cells. So in this case, the specificity is more towards the cancer cells, so the toxicities will be reduced significantly. At the same time, what they have done is they have also designed this GlyTR, that is Glycan dependent T cell recruiter, to overcome the immunosuppressions, which is mainly the case with most of the cancer therapies in the solid tumors. Because of this immunosuppressions happen in this tumor microenvironment. In order to avoid that, they have used these immunocheckpoint inhibitions of this beta-1,6 branching, which is on the outer layer of the glycocalyx. So it will prevent the beta-1,6 branching to inhibit the T cells, and when this beta-1,6 branching interactions is inhibited, then the regulatory T cells interactions with the normal T cells will be prevented, and these regulatory T cells also suppress the activated T cells. At the same time, this hypoxia and TGF-beta interactions with the T cells is also prevented. So all these interactions are prevented, thereby the immunosuppressions of these T cells will be reduced significantly. In that way, the activated T cells can act on the cancer cells, and the results are shown in this in vivo mice model, where we can see that when they use this Glycan dependent T cell recruiter, tumor suppression is significantly higher compared to the control. Afterwards, they check this Glycan dependent T cell recruiter with exhausted T cells from the patients on the patient's tumor, and the exhausted T cells markers, that is HTIM3 and PD1, human PD1, shows that 58% around the cells are the exhausted T cells, and when they use them with this Glycan dependent T cell recruiter, they are able to see that tumor cells are dead compared to the control case where tumor cells are not dead. So this approach clearly shows that one can use this Velcro like binding along with this TACA to improve the cancer therapy efficacy and reduce its side effects or toxicities. We will discuss the results in detail in our subsequent videos. So that's all for this video. If you need to understand more about this topic in detail, you can go through the reference that has been provided in the description. Thank you for your time.